Welcome, listeners, to today's episode of Women Leading Change, where we are excited to partner with the CGIAR Gender Impact Platform to bring you an insightful conversation on gender, nutrition, and food policies in West Africa. I had the privilege of speaking with Eileen Nchanji, a gender specialist at the Alliance of Bioversity International and the International Center for Tropical Agriculture. Eileen leads gender research and development across Africa through the Pan-Africa Bean Research Alliance, PABRA. In this episode, Eileen shared 5 powerful insights into the challenges and opportunities shaping gender equality in food systems and nutrition policy. Firstly, on integrating gender and measuring outcomes. Eileen emphasized the importance of not only integrating gender across the food system, but also establishing indicators to measure whether desired outcomes are being achieved. Secondly, challenges in financing gender initiatives. She highlighted that funding for gender initiatives is often not targeted towards empowering women to lead, make decisions, and influence institutional changes. Instead, resources tend to focus more on awareness and training, with very limited investment in implementation and measuring real impact. Thirdly, on engaging young people in healthy nutrition. Eileen discussed the need to engage young people in promoting the value of healthy, nutritious food. She pointed out that social media and advertising often promotes cheap, overly processed foods, which can undermine these efforts. Fourthly, on limitations of generic nutrition policies. She pointed out that nutrition policies are often too generic and fail to address issues like anemia effectively. There's also a lack of clear strategies, actionable plans, and designated roles for stakeholders in implementation. And finally, the need for multi-sectoral, bottom-up approach. We wrapped up our conversation with Eileen, stressing the importance of a multi-sectoral, bottom-up approach that brings together diverse stakeholders and government sectors to foster collaboration, reflection, and feedback for meaningful change. So stay tuned and enjoy this thought-provoking conversation. So Eileen, you're very welcome. To start, can you just tell us about your role as a gender specialist and some of the challenges you faced in promoting gender equality in food systems in Africa?
So thank you very much, Lena, and I'm happy for us to have this chat. Gender is integrated across, the whole food system. So I work with breeders to understand what farmers, what processors, what traders, different institutions are interested in. We work with them to develop the traits that they want in different varieties, making sure that when products are developed at the end of the day, these different clients are able to get what they're interested in or what they need for them to be able to consume as well as sell. So we make sure most of the product profiles that are developed target different markets, different clients, and also that they are inclusive and equitable. So we also work across nutrition because diets are very important, but also then if you look at women, that's more like pregnant women, lactating mothers. So just saying these are not homogeneous groups. I look at school-going children, whether they're boys or girls. In most cases, they need different dietary needs. And so what we've done is created like guides and manuals to be able to build a conversation around that, what the gender dynamics when we talk about food production, distribution, consumption, who decides what is eaten in the household, what quantities and qualities go to whom. We also look at issues to do with markets, because definitely the two competing elements that we have to watch out for is food for consumption, food for commercialization. So all the food doesn't go to the market, and the farmers themselves, do not eat nutritious and healthy foods. Another important element that often is not spoken about is coming up with gender transformative indicators. So it's not only about integrating gender across the food system, but also putting in place indicators where you can be able to measure and see, have you been able to create those positive outcomes you're looking at? So increase food and nutrition security, for example, reducing poverty, reducing hunger. If we've not gotten to the targets, what then do we need to do? So how do we gather that information, that evidence, and feed it back into the gender work we do? An example is the work we are doing in Tanzania in relation to the school feeding programs. So how do you get women involved? How do you get youths involved? How do you get men involved? And so putting them in a position where they can make decisions, they can lead the decisions, they have a voice, and also institution and structural changes. Another one is really the gender budgeting. So yes, we're seeing change where donors are saying for every activity you want to do, every project, there has to be a gender component. But still, when it comes to implementation, I think gender is one of those areas where we get the least amount of money, where there's more focus on an awareness creation training, and not so much on implementing it and being able to measure the change.
Thank you so much for really that broad presentation on these challenges. Can you speak to us a bit more about how your research addresses the unique food security issues that women face?
At the Pan-African Beans Alliance, we're using what we're calling the food basket approach. So because we work, I would say, exclusively on beans, but we're also working with other colleagues on other crops. For beans, what we've done is we've been able to have high iron and zinc beans. And high iron and zinc beans, iron addresses issues to do with anemia, mostly amongst women, so pregnant women, but also then school-growing children. But we also acknowledge that looking only at iron and zinc cannot solve the problems that we have. So we're also working within other initiatives. I would be talking about the East African and Southern Initiative, where we're integrating also legumes, integrating maize, integrating vegetables and fodder in what we're calling mother and baby demos. So the mother demonstration sites is when farmers go and learn how to intercrop these different crops, and then now learning that technology, they can take it to the baby demos, which is their farms. So making sure that farmers have enough legumes, but also the fruits, the vegetables, nuts and cereals that they need to have a healthy diet. The second thing we're doing is we're having this awareness creation and sensitization workshops. And the focus is understanding the roles of men and women when it comes to food preparation, when it comes to purchase of food, and also looking at sort of like the intergenerational implications. So we're making sure when we're having these awareness creations and workshops, we're also bringing in youths, and we're bringing also students from primary, secondary school, as well as their teachers, so that the next generation has a better idea on what do you grow, why do you grow it, but what are the nutritional benefits of what you're growing, and how can the household together, so not just women doing all the activities, because in Africa, culturally, women are sort of like looked upon as those who do everything that has to do with food preparation and sometimes production of it. But how do we engage men in this so they support, so they understand why they should consume a mix of, these different food groups and not just one? We are having discussions with the international rice organizations, so that's Africa Rice and also the International Rice Research Organization, on how to intercrop beans and rice, especially in Ghana. So you grow the rice, and then, by the time you're harvesting the rice, the moisture is still there, and then you can actually grow the beans, which is great, especially in Ghana, where there's a focus more on rain-fed agriculture and not so much irrigation happening there. Another thing we're also doing is not just looking at the quantity of iron or zinc, for example, in beans, but also looking at the bioavailability of it. In some countries, we are engaging the Ministry of Health as well, because this really is an activity that is multi-sectoral, that we cannot do alone. So how can we complement some of these minerals, micronutrient with, what we also get from the health sector? So for example, a pregnant woman cannot eat only beans, but also would have to take, for example, some iron tablets. So we're looking at how to do that. We've moved beyond that, and we're working with women, especially and youths, who are processing common beans, so adding value to it. And we're looking at it from three angles. We're looking at food safety, because we want healthier nutrition diets, but also these have to be done in a way that we consume them and there's no harm. We're also looking at how to make sure that as we combine beans with other products, like in Burundi, we have bean porridge. It has beans, it has sesame, it has maize, and other grains. How do we make sure in combining it, we're still able to, at the end of the day, have a product that's nutritious, where all the nutritional elements can plainly even be seen in the packaging. So that means working with the food safety regulation authorities in those countries to make sure that what we have in the market would really serve the purpose for which it is being made. Another thing we're also doing is looking at it from the breeding angle. How can we have this iron and zinc across multiple variety types? So yeah, those are some of the things that we've been doing within the Pan-African Bean Research Alliance to make sure that we have nutritious and healthy foods, available to our clients, consumers, farmers, processors, and even institutions.
Thank you so very much for that exhaustive view as to, just how just very, very carefully done research can influence a broader approach and really a deep approach to impacting issues of food security. A recent OECD SWAC report highlighted that high food costs and unaffordability are major barriers to healthy diets in West Africa. And this is not just the case for the key group that we're discussing today, women, especially those who are pregnant or breastfeeding, but across, the West African region, many countries have experienced in a post-COVID world inflation and the cost of food skyrocketing. So I'd love to hear. So how do you approach this from a policy point of view and in a multi-sectoral approach as you described?
So, Lena, thank you for that. You're right. I mean, we're seeing a high rate of overnutrition, malnutrition in West Africa, especially, but across the continent. The poor quality of diet, high cost of food, as you mentioned. And I think also another thing which is really coming out clearly from that is if we look at the average income that an individual has in Africa,
Yeah.
should be about $5.5 to $6. But if we look at the cost of food, averagely across is about 2 to 3.5 US dollars. So, of course, I mean, I've talked a lot about what's happening to men and women from sort of like an intersectional approach, but also with the crisis, issues to do with COVID, but also the political crisis across the countries. So I would say multi-sectoral approach. It's really, you look at the Ministry of Education, because like I said, we need an intergenerational approach. The young people coming up need to understand the value of eating healthy and nutrition foods. They need to understand what type of food is good quality or not. And if we look at social media now, television and radio, what is really promoted is foods that are overprocessed. And most of the foods that are overprocessed are actually cheap. I think that was like 3 years ago when some data was published in Kenya that almost every parent was going for pasta.
Yeah.
Which is easy to just prepare, but they're not thinking of the vegetables, accompanying it with fruits, accompanying it, with sort of like other legumes, so that the diet, then it's rich and healthy. So I think first, Ministry of Education. Secondly, the Ministry of Health, because when we talk about health, we're looking at so many different things, of which food is important, because it's not only the over or undernutrition, but also we're talking about communication diseases. In Kenya now, beyond the Ministry of Education and Health, We also have NGOs, international, national NGOs. We also have civil society that actually focus on issues to do with health. We have the humanitarian organizations as well. I think there needs to be some synergy so that we don't duplicate our efforts, but we become more effective on how we roll activities. What is also important is the Ministry of Finance. So in the budgets for countries, often we talk about 10% should be kept for agriculture, which I think as of now, we don't have any country yet that has put 10% for agriculture. You cannot talk about agriculture without nutrition. Because if you don't grow the food, then you have nothing to consume except you import it. But if the other country is not also growing it, then even importing becomes a problem. And also looking at issues to do with the quality of food that comes into the country. So that means here we're talking about the regional bodies. So we are not only talking about this multi-sectoral approach of partners within one country, but across countries. I would say we have policies in place on how to address issues to do with nutrition, but most of the policies are generic. So I think it was only 2 years ago where Kenya came up with a policy on nutrition looking at adolescents. So these intersectional elements are important. What about school-going children? So there's a lot of school feeding programs happening across the countries, but I've not come across any policy, for example, that targets that group of people. We always say that anemia is one of the biggest micronutrient deficiency issue that we have across the African continent. But this information is what you get when country data is being collected. But there's no policy that targets those who suffer from anemia with strategies and action plans on how this should happen. Another issue with policies sometimes is the implementation. Two ways of looking at it is we often say it's not implemented because the policies are so generic that it's difficult to determine exactly what to do. Sometimes the policies are there, but there's no clear action plan on how that should happen and who should be not only sitting at the table, but, getting their voices heard. Sometimes is problematic because I've had discussions with policymakers who say, before I was voted in, I promised I was going to do 1, 2, 3. In most cases, open a road, provide people with job opportunities, but they don't think about the health of the people. So I think there also needs to be a mind change around that. Across multiple countries, you have working groups on gender, on nutrition, on agriculture. So I think it's really important to pull these working groups together. Because you cannot talk about gender on its own. You cannot talk about agriculture on its own. There needs to be a synergy, discussions, reflections, feedback, and change.
Thank you so very much for, again, such a comprehensive picture. And what I hear you describing is not only a bottom-up approach, but also a whole-of-government approach. You mentioned a number of governments, ministries, line ministries. I would also include to that list, of course, I know you have this in mind, like the Ministry of Environment is a natural partner. You mentioned the Ministry of Finance, ministries of trade, given symbiotic relations between various countries and trade relations across various regions, the role of ministries of trade in trade facilitation is a key one, given seasonal calendars and agricultural calendars across various regions in West, East, and South and North Africa. And you also speak of a whole of society approach with the role of NGOs, regional bodies, and regional actors. So this is really indeed a challenge, a multi-stakeholder challenge that we are looking at. So just to close our conversation, you spoke about the importance of a mind change, but also greater collaboration and coordination. Could you just close with some ideas as to how to achieve greater synergy in such a fragmented context, under-resourced context, lots of institutions not having the resources they need for us to be able to achieve this whole of society, whole of government, bottom-up approach in a synergistic kind of way? So how do you think we can achieve greater synergy to actually push things forward, share ideas, and achieve greater impact?
So I would say probably my parting shot would be if we work together and we're less fragmented, we are going to go far. So pulling our hands together and everyone contributing, having a voice and making sure their interests are considered and heard. We need to keep talking. And what I always say is for one's behavior to change, it's almost like I listened to a song the first day and I was like, oh, sounds interesting. But then I forget it. But if every day I keep listening to the same song, the next minute I'd find myself humming it. And then I enjoy it and I love it. So that's how the behaviors can change. The issue is often the activities we have are ad hoc. So, there's a sensitization, awareness creation once a year. And then we go there after 2 years. Farmers have already forgotten what we said.
Thanks to Eileen for sharing her rich experience on gender, nutrition, and food policies in Africa. It was great to explore the importance of integrating gender, focusing on measurable outcomes, addressing financing challenges, engaging youth in healthy nutrition, and fostering a multi-sectoral, bottom-up approach. We hope you enjoyed the conversation. Stay tuned for more on these important topics. Until next time, thank you for joining us. Goodbye.